Okay, 9:20 a.m., 6.4, consideration of presentation on the multi-county agency full functional evacuation shelter crisis. And this is by Health Services. Come on up.
Thank you, Madam Chair. We have Dean Eichelman, who is our Emergency Preparedness Program Coordinator, and Christine Hannigan, the Staff Services Analyst. And we also have Judy Garcia, the Health Program Manager, in the audience.
All right. Good morning. Thank you for the introduction. So yes, Dean Eichelman with the Health Services Department. I'm the Emergency Preparedness Coordinator and joined here with Christine.
Good morning. I'm Christine Hannigan. I am a Staff Services Analyst with the Emergency Preparedness Program.
Want to put the microphone in between you guys?
Good morning. Christine Hannigan, a Staff Services Analyst with the Emergency Preparedness Program, and I've also recently taken over coordination of Lake County Medical Reserve Corps.
All right. Good morning. So thank you for giving us the opportunity to present on this exercise that we did on December 6th at Twin Pine Event Center. So we oversee a variety of different emergency preparedness grants within our department, and one of our grant deliverables for this year was to coordinate a full functional exercise with our Lake County Medical Reserve Corps. So I'll go to the next slide here, and we'll give you an overview on the MRC.
So the Medical Reserve Corps is a national network of healthcare volunteer units, with each unit being coordinated locally. The Lake County Medical Reserve Corps was accredited in 2007 and is coordinated through Public Health's Emergency Preparedness Program. Members are registered by our program through the state's Disaster Healthcare Volunteer website and are also signed up through the Lake County Volunteer process through Human Resources. The main purpose of the Medical Reserve Corps is to provide healthcare services in times of emergency. Other activations support community needs such as vaccination. Among other deployments, Lake County MRC volunteers have been used to staff first aid nursing positions at evacuation shelters, vaccinator and vaccine coordination programs at influenza and COVID-19 mass vaccination clinics, and COVID-19 testing and contact tracing positions. This exercise was originally intended to be a training for the Lake County MRC on medical roles in evacuation shelters, but became an opportunity for collaboration with other agencies for expanded training.
Thank you, Christine. And so, yeah, with that, with our MRC in mind and planning out a full functional exercise with them, we decided a evacuation shelter scenario would be a great opportunity for them to practice their response to our community when they're presenting as an evacuee at a shelter, potentially with medical needs. So we decided to expand it and start working with the other organizations within the county that would set up an evacuation shelter. So the Department of Social Services, American Red Cross, at Lake County Animal Control, Lake County OES, Lake County Behavioral Health, and then of course our department with Public Health. We did this on a fairly compressed time frame, so we began our first planning meeting on October 16th with these agencies, set up our goals and objectives for the exercise. One of the big things is wanted to find a venue that had previously been used as an evacuation shelter within the county. And so that's why we decided on Twin Pine. It's historically been an evacuation site in the county. I'd like to take the opportunity to thank Supervisor Simon for helping us secure the location. And the staff there was great to work with. We organized some actors to present to the shelter as evacuees through the participating agencies. So all the actors were either County of Lake employees or with the American Red Cross. So the exercise played out as a wildland fire evacuation scenario with the support of Lake County OES that was there at the exercise. They initiated the activation phase for the exercise. They contacted the Department of Social Services and let them know that a shelter site was needed for setup, and then Social Services went ahead and played through the simulation of that setup. So the American Cross, Animal Control, and Social Services all started setting up everything as if it was the real thing, including cots and all that. And then the actors that we had come in, like I said, staff from the different departments, we assigned different scripts to. So some of them came in with pets from Animal Control. And when they went through the registration process, they were directed to go ahead and check in with Animal Control to register their pet. In a lot of sheltering scenarios in Lake County, you're not able to cohabitate with your pet, so that was where Animal Control came in this case, gave them a good opportunity to practice. Some of the actors came in with behavioral health needs, so behavioral health staff were able to practice through conducting their assessments. And then, of course, staff from our department were acting out as an evacuee that needed medical support at the shelter, presenting without their prescription oxygen or maybe coming to the shelter with injuries. That gave our Lake County Medical Reserve Corps the opportunity to practice their response to those folks. So overall, we felt the exercise was very successful. Definitely allowed us the opportunity to understand our expectations with all these agencies going into the next type of scenario where an evacuation shelter would be needed in the county. Opportunity to practice together in a controlled environment. That's really big. A lot of these things just start and you have to go, set everything up. So this gave us that opportunity to connect with each other, build those relationships ahead of time. I want to say every department that we worked with to set this up was very supportive, had full buy-in. Most of these types of things can take over a year to plan. Because of that dedication and commitment, we were able to do this that quick. So, we came away with it with confidence to support our county, which is our number one goal in the event of a disaster. See on the slide here, the different participating agencies. We had 54 attendees, so really good turnout.
Was Catholic Charities, did they participate?
They did not, no. Only other thing here, we will be doing a after-action report on this, just to capture the things that we did well and our opportunities for improvement for future responses. And so that concludes our presentation. I've got our contact information up on the screen here. Feel free to reach out to us with any questions, comments. Again, thank you for the opportunity to present today, and we're available for any other questions now if you like.
Wonderful. Thank you for the presentation. Do we have questions? Supervisor Sabatier?
Thank you so much for doing this. It's always a hectic situation when it's live, so it's a whole lot easier to go through it without the actual fire and the actual situation occurring. Appreciate the fact that we're doing those exercises. Best day ever for those dogs coming from Animal Control. That was a field trip for them, so that must have been fun. Just curious, I get it that it could be maybe an outside source where you could just kind of make up the story and see how staff in the exercise would react. But as soon as I saw that this was a shelter and that medical reserves were involved, were the hospitals invited or involved, or in the future, is that a possibility? Or is that more of a scenario that you just write out and then you figure out how the staff that were there for this exercise kind of delegate and deal with issues of bringing people from the shelter to the hospital or taking folks from the hospital if there's beds that are needed to be cleared at the hospital or whatever the case might be?
Yeah, thank you for the question. So, we did not work with the hospitals during this because we did want to focus on that element of the shelter piece. Yes, that could definitely be a potential for us to expand in the future. The main thing, and this is a big part of the Lake County Medical Reserve Corps, is to care for people in the shelter if at all possible, because that's our goal. We're trying to reduce that burden on the hospital and hopefully not send them there. So that was the focus for this one.
Thank you very much.
Supervisor Green?
Yeah, thank you. Thank you for doing this on basically a very short timeline on the animal response. and this may not have been part of the scenario, but obviously people with pets in shelter, that would be one situation, but for mass evacuations, large animals sometimes come into play. So did this scenario dive into any large animal sheltering?
No, it did not. Yeah, it was just focused on, what we would do with pets in that. Yeah, lots of different pieces, of course, to consider during this type of thing. Thank you.
Sure. I think that's been a challenge, obviously, over the years. So thank you.
Vice Chair Simon?
Yeah, obviously, great doing the training when there's not something going on. So I'm glad to see the proactive work on that. Obviously, we have the cot set up there with Red Cross and all the relationships we have at Twin Pines. So, and I know throughout the county, there are many other places. You have the Clear Lake Community Center. I know we have all the schools and everything. It'd be great to see it moving around the county on a yearly basis, so we're prepared everywhere. When we talk about risk, I know fire is what we're dealing with, but floods, earthquake, being prepared for that down the road, I think is really important. So, it was a good job.
Thank you.
Thank you.
Yeah, and I really appreciated the pet part. I've worked in shelters a lot, and that is the missing link. We have so many people that show up with their pets or their family, and they have to be separated, and we're not exactly sure what to do. And we've made some investments with animal control to help care for the animals during this time. So I'm really happy to see that piece worked on. Supervisor Crandall.
Yeah, thank you for the presentation. I appreciate the fact that there's training happening. Regardless of anything, it's a proactive approach. We all know that anytime an emergency happens, things can go a different way. But the fact that you're training and making those relationships gives you all the opportunity to kind of adjust as needed. Whereas when we don't, you're just like kind of learning like we have in the past, right? And so this is really helpful. Thanks.
Thank you.
Do we have any comments from the public? Anyone in the chambers or the Zoom room? Okay, we've got one hand. Betsy, okay, go ahead and unmute. State your name.
Thank you, Madam Chair. Betsy Kahn for the Essential Public Information Center and the Lake County COAD, the community organizations active in disasters. When you asked the question about whether Catholic Charities had been involved, that's a missing link. There are three things that I think would be helpful to address. First of all, how did you simulate the call to action? We have many instances where our telephone and internet services go down. In fact, this board postponed its December 5th meeting because of a blanket internet outage so that they could include the rest of the public. This is a constant problem. We try to make up for that with radio broadcasts from KPFZ, but of course we're not an official outlet for the Sheriff's Office or Emergency Services. So I'd like to see you include communication testing and then, the use of the COAD network, which includes the Red Cross. So thank you very much.
Thank you.
Thank you.
Okay. Any other public comment? All right, then we'll bring it back for any final comments. Just appreciate as proactive as we can possibly be at all times. So thank you for this work. And thank you to all the partners that did participate.
Thank you very much.
Thank you.